Well, welcome everyone to our March LNEC webinar. Today, we're going to be sharing some new educational videos that reflect Mexican American populations, specifically within a palliative care setting. I want to introduce some of the co-presenters with me today. So first, I'm Dr. Megan Lippy. I'm one of the LNEC co-investigators supporting schools of nursing. And I'm also an associate professor at UT Health San Antonio. I'm joined today by Dr. Andrea Burciaga Rivera, who's an assistant professor at the University of Texas, Rio Grande Valley, who was a collaborator, a co-investigator on this grant-funded project, and Dr. Andrea Davis, who is associate professor at University of Portland and an LNEC co-investigator, and also supports the School of Nursing work within LNEC. And then just want to give a shout out to our undergrad student who was a contributor to this project, Natalie Hernandez, who's in clinical and can't join today, but thrilled to just want to acknowledge her as this. As we get started, if you don't mind just dropping in the chat where you're joining us from. I'm seeing quite a few familiar faces, but would love to kind of see where you're coming from as we get started. To provide a little bit of an orientation. So we're going to share a little bit about how these videos came to be, and then want to spend some time actually going to the videos themselves, showing y'all the resources we've created to support video utilization. And then we can kind of envision as a group how these might be useful in your own teaching. So, I do want to acknowledge that the funding, so these videos were funded by the Texas Organization of Baccalaureate and Graduate Nursing Education. We call it TBAGNI, as well as from support at my own School of Nursing, and then LNEC. And then we always like to acknowledge that these webinars are made possible by LNEC and the Cambia Health Foundation. The project that we're going to share, again, it's highlighting through videos the Mexican American population, and these came into being for several reasons. One of the biggest ones being that is Dr. Davis and I were working on revisions to LNEC undergraduate curriculum. We saw consistent feedback from users that they wanted more representation and diversity within the modules and within the videos, and so we took that as an opportunity to think about how we might address that concern from participants or for users of the curriculum. And then also being located in Texas and having a fantastic colleague, Andrea, who's with me, wanting to think about how can I work with my community here in Texas to address that concern. So with this project, our first aim was to develop some vignettes that reflect the sociocultural, spiritual beliefs and values of Mexican Americans living with serious illness and their families. And then the second aim was to then create those videos. And so we'll show you the products of that today. We have 5 videos in total that we created. These are all on a YouTube channel, which we have the link in these slides, which these slides will be sent out after the webinar. But one is an expert testimonial about from Andrea, who shares about her experiences in providing palliative care to Mexican American patients and families, specifically along the Texas-Mexico border and sort of in the South Texas region. We have a video of a cultural spiritual assessment, a family-focused palliative care in difficult decision-making, which is where we kind of portrays family dynamics that might be involved when decisions need to be made. The patient in that scenario has sort of mid-stage dementia and is needing to make a decision about dialysis or not. And so we kind of see that family dynamic play out. And then the last 2 videos are pain assessment videos that can be used separately or in combination. These address 2 different things. One video shows a very thorough pain assessment, as we would hope our nurses are performing, and the other shows more of an incomplete pain assessment. But then the other aim of them is that we show the more thorough pain assessments conducted with the use of an interpreter, whereas the other one uses a family member to translate. And so those videos can be used to either show high quality versus lower quality pain assessments, or to explore issues of working with patients who speak a primary language other than English, and how might you navigate that effectively? The study was set up like as a Delphi study. And so we reached out, well, first we wrote the vignette. So the team of 4 of us came together, identified gaps in the curriculum in terms of things we wish we had videos to portray. And then we wrote those vignettes. Natalie, who's our undergrad student, sort of took the first stab at that, which I'm so thankful for her for doing that. She is also from the Rio Grande Valley, which is near the Texas-Mexico border, and wanted to capture elements of her experiences with her family or with her community. So she started those drafts, and then we as a team worked on them. But we wanted to make sure that they really were an accurate representation of this population, and also wanted to be very intentional that we weren't propagating stereotypes, that we weren't putting things in the videos that would potentially be discriminatory or again, stereotyping individuals. So to get that feedback, we worked with the community. So we had 10 individuals, this is who we recruited, who either identified as Hispanics of Mexican origin or Mexican American, have expertise caring for patients from this population, or they conduct scholarship with this population. So they need to have an intimate knowledge of this population. We wanted individuals who have a nursing background, so either faculty in a school of nursing or registered nurse with palliative or hospice care experience. And then obviously ability to do electronic surveys. And although expertise in palliative care is preferred, it wasn't required. But so we had a nice robust representation of individuals along the palliative care continuum. In the first survey, we asked our participants to identify AACN concepts that come from the essentials that were demonstrated within the scripts for the videos themselves. And then also in the literature, there's these 5 themes that come up, or these values reflecting the Mexican American community that are important and very frequently cited in the literature as important for that population. So we asked our respondents to identify any of those values that might be present within the video scripts as well. So we got that information from them. And then in the second survey, we sent the scripts again with those themes. And we asked our respondents to rate the importance of those themes to achieving the objectives of the video itself, the accuracy of those scripts in portraying, again, a realistic, real world interaction with this community, and then the acceptability, again, really trying to make sure that we weren't, that the videos were an accurate, acceptable reflection of the community. And for the second survey, and actually for the first survey too, we provided lots of definitions. So defined the themes, either what came from the essentials or from the literature. For this second survey, we actually had very detailed descriptions of what each of these categories meant. And anytime somebody, put a score of, somewhat accurate or somewhat important or not accurate, we ask them to share more with us, tell us what about it needs to be addressed. And so the great thing was that when we got that first round of surveys back, and we had 10 participants complete that, everyone rated the videos as completely acceptable. And the only element that was identified as needing some revision was related to accuracy with how we portrayed the introduction of the interpreter into that pain assessment scenario. So we took that video to a colleague of mine who who actually created a medical interpreter training course, and asked her to weigh in. So thank you, Dr. Cavazos, for that. She reviewed that script and made sure that we set up the scenario and provided information that accurately portrays best practice when working with an interpreter, and really sort of aligns with the code of ethics for medical interpreters. So that was a revision that we made, but otherwise the respondents all said that they felt that the videos were accurate and acceptable and conveyed the themes in a meaningful way. So then we created the videos. We recruited students and faculty from within the School of Nursing to serve as our actors for this, and worked with our media department here at UT Health and are thrilled to show the final product. So these have been posted onto the UT Health San Antonio YouTube page, and we provide a link to those in the faculty corner, and I'll show everyone how to get to those. And we are going, working on a manuscript related to this, and very excited to share that Dr. Davis, who's one of our teams, has gotten funding from University of Portland to do a similar type study to create additional video vignettes, but this time representing the LGBTQ plus community. So very excited for that. And we have taken a lot of lessons learned from this development process, and we're applying it to our videos that we'll be creating next. So to find the videos, I've got some screenshots here, but you would go to the LNAC faculty corner and the links here. And we posted the videos under our teaching tabs in resources. And when you click on there, it's under our digital media tab. And it's this section called Improving Representation in Primary Palliative Care. And so what I'm going to do next is we're going to actually go to the videos themselves. Are y'all still seeing my screen okay? Yeah, okay, great. So on the faculty corner, again, under the digital media, we have these 5 videos. They each have the description provided, and we wanted to just orient faculty to how these resources can be accessed and utilized. One of the things that we developed as a companion to each video was a faculty resource guide. And so when you open these guides, it's a PDF. It provides a description for what that video is intended to convey. For the pain assessment ones, it also signals that we have that companion video that you might use. We talk about the modules within the LNAC undergraduate or LNAC graduate curricula that would pertain or that might relate to elements of the video itself. We've created learning objectives for each video and provide instructions for faculty about how you might use this video. And this is just a recommendation. This is not a limitation of the only way you could use it, but ways to perhaps introduce this to your students. We also talk about, if you're wanting to use, for example, these pain videos to explore pain assessment, we give some things that you might want to consider. If you're wanting to look at from an interpreter perspective, we again provide some instructions for that. We then have debriefing resources within every guide. So for example, for the pain videos, we share these 2 mnemonics. Old Carts is in our LNAC video, or is in our LNAC pain module. PQRSTU is another commonly used one. And we provide faculty with information of what questions are asked within the video itself that align with those mnemonics. Now, this specific guide is for the opportunities for improvement pain assessment video, where we know the individual's not conducting a thorough pain assessment. So that's why you see not assessed here. So the other video has a full complement of questions in there. We also provide in each of these guides possible resources that faculty might want to consider. Maybe these are assigned readings or other resources that we found were helpful for us in developing these videos, but could be helpful resources for you to sort of include within the overall use of these videos. And also, if this is an area where you're wanting more information, this would be useful for you as a faculty to access those resources. And then the last piece of all of the guides is we know we're in a place of competency-based education. And so we aligned each video with the essentials. And so you'll see that for curricular alignment, we have all videos have been aligned to our CARES competencies for undergraduates. These are our palliative care competency statements that are AACN and LNAC endorsed. And then we align it with the domains, competencies, sub-competencies of the essentials and the essentials concepts. We do that also for our graduate programs. So aligned the videos with elements of our graduate palliative care competencies, and then the advanced level elements of the essentials. So that all of those guides will look similar in terms of the layout of them. And then we do have one expert testimonial. So for example, that resource guide, very, very similar in its layout. But for this one, as we thought about alignment with the essentials, we offer, for example, one option might be to have students take an implicit bias test before watching this video and maybe after this video. So again, encourage faculty to look into that more, especially if there's a video that particularly piques your interest. Before I go to the videos themselves, are there any questions in the chat? Andrea, anything I need to?
No, I just want to reiterate that there was a lot of time and detail put in those faculty guides. You all did a great job with that. I didn't have a lot to do with that part of it, but objectives are there for you to just sort of cut and paste into your particular module or whatever you're doing in the classroom or clinical or wherever you might use that. So there's just a lot there already done for you.
And again, if you have questions, please feel free to drop those in the chat, or you can raise your hand and we'll answer those.
I did drop in the chat the link to get directly there if people wanted to follow along with you.
Perfect. Thank you so much. All right, so what we're going to do is show some of the videos. We may not have time to get through all of them, but we thought we might show some of these and just as a way to introduce them, because we are really proud of the work. And then also to, as a group, kind of think about how might you integrate these into your teaching. So the first one I want to go to is our pain assessment with interpreter. This is the better practice. And again, the intention of this is twofold. One is to show a very thorough pain assessment. The other one is to demonstrate how an interpreter might be effectively used in this. So we're going to go to the video. And briefly before, the links are not discoverable. Like you couldn't search for these. You will need to access these. You will need to go to the faculty corner to get the links. And that's very intentional because we want faculty to make sure they know where to find those faculty guides that go with it, especially as we have this pain assessment that we know is not the greatest. And that was intentionally designed, but we don't want people thinking that it's supposed to be a good one because it's not. When you go to the site itself, there's also that summary description provided in the description and some of those objectives and that sort of thing. But with that, we're going to show this first one.
Hello, this is William. I have a patient in room 3 that only speaks Spanish. Can I get an interpreter down here while I do a pain assessment?
Yes, of course. I'm on my way.
I'm going to pause real quick at this screen. So as I mentioned, we had feedback from our participants saying that the representation of the work with the interpreter needed some changes. And so one of the recommendations from our expert with medical interpretation was that in a real world scenario, the interpreter would go into the room and introduce themselves and explain the role of the interpreter. Since these videos are targeted for nursing students and nursing faculty, we felt like depicting all that in a video might not be the best use of time. So instead we just have this little summary here to say, yes, that has occurred prior to what you're going to see with the patient interaction.
Hello, my name is William. I'm going to be your nurse today.
Hola, me llamo William. Voy a ser su enfermero el día de hoy.
Hola, me llamo Julián.
Hello, my name is Julián.
So I hear you're visiting us today because of some pain. Is it all right if I ask you some questions about that pain?
Entiendo que vino a la clínica hoy con dolor. ¿Está bien si le hago preguntas sobre su dolor?
Sí, está bien.
Yes, that's fine.
When did the pain start?
¿Cuándo empezó su dolor?
Creo hace 2 semanas, pero no estoy seguro.
I think about 2 weeks ago. I'm not sure.
Where does it hurt?
¿Dónde le duele?
Aquí en la espalda.
In his back.
On a pain scale of 0 to 10, 0 being no pain, 10 being the worst pain, how would you rate your pain?
Puede calificar su dolor en una escala de 0 a 10. 0 significa no dolor y 10 significa el dolor más peor posible.
Yo diría como un 8, pero me duele mucho.
I would say about an 8. It hurts a lot.
Okay. How would you describe the pain?
¿Puede describir su dolor?
Es un dolor agudo.
It's a sharp pain.
Do you feel the pain anywhere else?
¿Siente el dolor en algún otro lugar?
No.
No.
Can you say what makes the pain better or worse?
¿Puede decirnos qué hace el dolor mejor o peor?
Sí, cuando estoy sentado no me duele mucho, pero cuando estoy de pie por más de una hora, no puedo soportar el dolor mucho más.
Yes, when I'm sitting, I don't feel the pain that much, but when I'm standing for more than 1 hour, I can't stand the pain.
Okay, when you have pain, how long does it last?
Cuando tienen dolor, ¿cuánto tiempo dura?
Todo el día.
All day.
Have you ever had any treatment or taken any pain medication before?
¿Alguna vez usted ha tenido un tratamiento o toma medicamento para su dolor?
Sí, tomo Advil todos los días, pero no me ayuda mucho.
Yes, I take Advil every day, but it doesn't help me much.
With the Advil, how many do you normally take in a day?
Cuando se toma el Advil, ¿cuántas pastillas se toma por día?
Como 6 o 7.
About 6 or 7.
And when you take these, do you get any pain relief from it?
Cuando se toma el Advil, ¿le ayuda con el dolor?
Diría más o menos mejor, pero no mucho.
I would say more or less better, but not much better.
How has the pain affected you for your daily activities like bathing or showering?
¿Cómo le ha afectado el dolor a sus actividades diariamente? Por ejemplo, bañándose o cambiar de vestidura.
Ya no puedo caminar o estar de pie y hace mi trabajo muy difícil porque trabajo en construcción.
I can't walk or stand for long periods of time. It makes my job difficult. I work in construction.
If the pain was better controlled, what might you be able to do that you find difficult right now?
Su dolor estuviera controlado. ¿Qué pudiera hacer hoy que no puede hacer?
Puedo hacer mi trabajo con menos dolor y me haría la vida más fácil.
I can work with less pain and it would make my life easier.
Would you be comfortable with me talking to the doctor about your pain medications?
¿Estaría dispuesto que yo vaya a hablar con el médico tocante de su plan?
Sí, está bien.
Yes, that's fine.
All right, I'll be back and I'll update you.
Voy a platicar con el médico tocante de su plan y luego después yo vengo a informarle de qué discutimos.
Gracias a usted.
Thank you.
I just wanted to, before you talk a bit more, to just reassure folks on our end, at least my end, there was occasional slowing in the streaming. But that's because of the interface here. The actual videos, there's no delay.
Okay, thanks for sharing that.
I wasn't sure you were seeing that, Megan.
No, smooth on my end, so thanks, thank you. So yeah, maybe don't stream it over a Zoom, but showing it from the link itself is good. So that's one of the videos. And just again, what we have one of our actors here today, Andrea, who was so critically instrumental in creating this. And then just want to shout out to my colleague Julian, who was our patient, and then special shout out to my husband, who the morning of, because one of our actors was sick, hopped in the car, and he is not a nurse. He threw on some scrubs and came to campus, and he was the nurse. So thanks to him, because it helped make this happen. So again, that was an example of one of the videos. And as a faculty, again, if you use the guide, we have old carts and PQRSTU where we've indicated the different questions that the nurse asks to the patient to try to do that full assessment. One of the things we want to encourage, students to cue into is that assessment included functional status. What can you do what could you do if your pain was better controlled? And that functional status piece is something really important as we think about holistic assessment and palliative care and quality of life. So hoping students would pick up on that, not only just, what is the intensity, but also that very robust holistic assessment. Now, the reality is this perfect? Probably not. So will students, identify places where the nurse could have asked something differently, or maybe something in the interaction could have been different? Yeah, absolutely. And that's what these videos are designed to do, is to get students thinking about how, if it was them, what might they do similarly, or what might they do differently? So next we'll hop over to the companion for this one, which is pain assessment using a family translator. And this is, again, intentionally a problematic scenario because we want to capture what we kind of see happening in real world at times. So it's not overly dramatized. We tried to create a scenario that really reflects what we see often at the bedside, but hoping students might see where there's downsides to using a family translator instead of an interpreter. So we'll go to that one next.
Hello, I'm Darlene. I'll be your nurse today.
¿Qué dice?
Dice que va a ser su enfermera.
If you can, would you be able to translate to your dad what I'm saying?
Sure,
Perfect. Can you ask him if he is in any pain?
he is in pain.
¿Qué dice?
Me preguntó si tiene dolor y le dije que sí.
Bueno, dije que tengo mucho dolor en la espalda.
He says his back hurts.
On a scale of 0 to 10, how much does it hurt?
En una escala de 0 a 10, ¿cuánto le duele?
Es como un 8.
He says about an 8.
When did his pain start?
It was about a week ago. He was picking up boxes at work and they were too heavy.
Okay, thanks. Do you feel that pain anywhere else?
¿Qué dice?
¿Siente dolor en algún otro lugar o nada más la espalda?
Bueno, el dolor es baja por las piernas, pero no tengo otros dolores en otras partes de mi cuerpo.
He says only his back.
Okay, tell him the doctor will write a new prescription for something stronger. And if he feels extra sleepy or confusion, he should stop taking it immediately and give us a call.
Okay.
¿Qué dice?
Tenemos que ir a recoger su medicamento.
Ay, muy bien, muchas gracias.
Thank you.
Great. So much shorter video with this one. And again, our actors in this, we have one of our DNP students, one of our BSN students was the daughter, and then one of our staff members was the patient. But hopefully you see maybe a compare contrast with those, that this is a very abbreviated pain assessment. Also, one of the things is we wanted to make sure we had subtitles for individuals who don't know Spanish, to help signal that there's things that the patient's saying that aren't getting transmitted to the nurse, or hopefully students pick up on the fact that there's time when the nurse asks a question and the daughter answers instead of the patient answering. And if comparing the two, we see in the first scenario, the nurse is looking at the patient, maintaining that eye contact between the patient. That would be best practice. Whereas in this video, the nurse kind of pivots and looks more at the daughter and not as much the patient. The patient gets sort of removed in some sense from that interaction. So with that, I thought, let's see, where are we at on time? We're doing good on time. So any thoughts, comments, thinking about how you might utilize this? I see Dan mentioned in the chat an opportunity, but again, if y'all have thoughts on this, we'd love to hear, and we can show some more, but thought we might open this up if anybody has ideas for ways you might utilize this in your classrooms.
It would be really great to hear from you too. This is sort of the first, outside of sharing this with some key stakeholders in Texas, that this has been shared. So we will welcome your ideas.
That's fine. I can put anyone on the spot.
Thank you for your presentation. My name is Mona Hibishi. I am an assistant professor at University of Northern Colorado School of Nursing. I have just only one question related to how to maintain like cultural or cultural safety in terms of developing or creating these videos, especially within Mexican immigrant, because I am looking in my research how to develop content for nursing student to deliver end of life care based on LNIC modules, and for sure to maintain cultural safety in this content for students.
That's a great question. Thanks for asking. I think for us, that was something we were mindful of as well. And so which is what we did is, again, really reached out to our community and tried to have individuals from that community, from that culture, read our scenarios and make sure that there wasn't anything in there that, again, was prejudicial or stereotypical or could be potentially threatening or misrepresenting that community. So having that extra lens, I'm not Hispanic, you know, and so I'm not from that community. And so for me, it was really important that I have individuals from the community look at this work. And we did have members of our team who are from that community, right? So Andrea's from the Texas-Mexico border, Natalie, who was our student, and also our actors, right? There was, for one of the videos, that very thorough pain assessment one, even the actor the day of, he said, I would never say it like this with my family. Like if we were really having this conversation, that's not how this would go. And so we did make some modifications even the day of, when we had our actors from that community there saying, this sounds very like clinical, not like a true interaction. So I think having, again, that feedback from many different individuals was important to make sure that these videos achieve the objectives we hope for, but also are
I wonder, are you speaking about how the addressing cultural safety in the videos in
Yes.
particular? Is that what you're
Yeah,
referring?
yeah, yeah. Especially when I think in the beginning of the presentation, there is like a content related to spiritual beliefs and the values for Mexican population. So I'm not sure how you addressing is cultural safety in this content when creating also videos.
Mhm. Do you have some thoughts?
Yeah.
I mean, that's your area of research?
Yeah, I'm interested in palliative care, but I'm looking for the Mexican Latino, especially with diverse population in Northern Colorado area. So I'm trying to not develop, but based on the LNIC modules, how to integrate the concept of cultural safety
Mhm.
within palliative care content to make sure that we are not, there is no barriers from student to deal with this population, or there is no issues, especially I am I am a second language person, so we have different perspectives.
Mhm.
How can I maintain this perspective when I create some modules in terms of different or diverse population, for example, Mexican or Latino population?
Mhm. Would these be just sort of a foundation to have that kind of conversation? Could you use this as a place to begin to have that kind of extend that conversation around cultural safety?
Yeah, I think it is a very preliminary research on this area to look how can establish my research program in terms of palliative care and also within diverse population in Northern Colorado area.
Mm-hmm.
And
Andrea,
we're
do you
always
have any
happy
thoughts?
Yeah, we're happy to connect, outside of this too. We can kind of share some of our thoughts with that. I think it's really, with all of these videos, it's about how you set it up, right? How you introduce it to the students. And so that's why for us, those faculty guides were a starting point, as things faculty might consider. But really, I think it's about how you establish the learning environment with your students to say, we're going to be watching some videos that represent diverse populations. That doesn't mean that this is how it will be for every patient, because every patient's unique. But what might we take from this video as some opportunities, and then how might we apply that to future interactions with our patient? So I think it's helping, again, how do you create that environment where students share that, but helping them think about how can this then how could this be applied in other scenarios? I mean, again, just how did it work with an interpreter, and how might we need to do that differently or similarly with other individuals, that sort of thing.
I wonder if Andrea has a thought. Yeah.
Yeah, I was just going to share. Thank you so much for the question. I think that, among Hispanics, there's 12 different, or Latinos, there's 12 different subgroups, right? And so everyone's different. And I think that the value of the videos, like someone's pointing out, I would have done it one way or presented the other one prior. I think that anyone who's trying to practice cultural humility within clinical practice and taking care of patients, there's so much to learn, right? It's a journey. We're never going to get it right 100% of the time. And each patient is individual in their beliefs, in their practices. Not all the Hispanics, I think one thing to Dr. Lippy's comment earlier on is just a platform for us to open up the door to ask patients and students, you know? I think in the comments prior and the data that was shown preliminary was that we did ask other faculty members, you know, because some people aren't comfortable at all. To your point about protecting, you know, culture safety, and, you know, we talk about awareness and sensitivity and practicing humility. And the reality is, does a patient even understand culture? I mean, we ask questions, what's your culture? And they're like, I don't know, what does that even mean? You know? And so I think that it's our job as educators to figure out and define what that means, and what does that mean for the patient, and how do we compromise to tell a patient, this is what's important for us to understand about you and what's important to you. And it's really just individualized to each patient, depending, and not aside from everything else, is what is important to the patient. And in palliative care, we're asking so many questions about how they want to live, what is quality. And so they're defining so many terms for us, that I think that's really important to consider when you start talking about protecting their culture.
Okay, thank you so much.
I think this is a good segue to the next video we wanted to show, which is our expert testimonial from Andrea. So I'm going to share my screen again and take us back to our videos. So this one's a little bit different. This is, again, not a vignette where we see patients and nurse interaction. This is actually I kind of think like the talking head from The Office, right? It's more the expert testimonial. But we see these in the LNEC modules, and so we wanted to hear from another expert.
My name is Andrea Burciaga, and I'm a nurse practitioner specializing in hospice and palliative care, practicing along the Texas-Mexico border. We're all unique in our cultural values, beliefs, and practices. So today I'd like to share some tips and strategies about caring for Mexican Americans living with serious illness and their families while practicing cultural humility. Imagine that today you're assigned to care for a patient and family of Mexican American culture. Family plays a central role, and decisions are often made collectively with family members. Family members are heavily involved in the care process, not only in caring for the patient, but also in making decisions. Don't be surprised when you walk in a room and there's 5, 10, 15 people. Collectively, as Mexican Americans, we make decisions together. So meanwhile, we're nervous about seeing so many people in the room. Remember, they all have something to share, and they all participate in caring for the patient. As a family unit, we live in multi-generational homes where grandma, mom, child, and even grandchild participate in care. So don't at any time think that there are too many people with too many opinions, because they all matter. The traditional structure of a Mexican family is heavily based on roles. The mother is at the center of domestic spaces and tasks, and the father works outside of the home. Children usually assume the role of caretakers. When caring for Mexican Americans, language is important. Most Hispanics and Mexican Americans speak Spanish in the home, so communication is key. Always think about offering nonverbal communication of respect. Respect is very important among Hispanic culture. In my career, I have cared for thousands of patients in these spaces, and even I've made mistakes caring for patients within my own community. So what does that mean for you as a nurse? Ask questions, get to know your patients, treat them with respect. Don't make any assumptions. We're all unique in our own values, our beliefs, and our healthcare practices. So don't forget to take the time to ask important questions. Get to know your patient and their family, no matter how many people that is, because they all matter.
Have our lovely end credits there. So again, that's a little bit of a different take on these types of videos. And again, when we set these up, again, our intent was never to say this represents everything for everybody, but again, wanting to hear from a palliative care provider from the community. And so I'm thrilled to have Andrea on our team to share her experiences And really wanted to center this on this idea of cultural humility as well. Let's do, I'm just sort of monitoring the chat. We can look at one more of the videos and then maybe we open up for discussion again some more. Yes, so these videos are all on our faculty corner. Again, when you go to the teaching resources section, so if you go to the LNAC faculty corner under resources, you click on teaching.
I popped the link in above, Dan.
And it's the digital media section. So the first two videos we watched are right here, the pain assessment ones. You can click on the guides and then also the link to the YouTube videos. And then whenever you go to one video, it does bring up our whole playlist related to these 5 videos. But again, you can get to that expert testimonial here as well as our other 2. So we'll do this other one is a cultural and spiritual assessment. This is one that we've heard from students that, they might know what a FICA assessment is, but how do they actually do it? What does that look like at the bedside? We felt that there was a good opportunity for us in these videos to demonstrate a cultural spiritual assessment. It's sort of set up as if, it's the nurse has been doing an admission assessment, and this is sort of just a continuation of that. So we'll go to this video next.
I'd like to ask you about things that are important to you related to your healthcare so that we can provide the best care possible. Is that okay?
Yeah, that's fine.
Do you mind if I take a few notes?
No, go ahead.
Okay, what languages do you speak?
I speak English and Spanish.
And what language do you prefer to speak and read?
It doesn't really matter to me. I'm bilingual, but English is fine.
How do you generally make decisions about your care?
So I make the decisions for myself, but I do like to involve my husband when it comes to big decisions.
Okay, thank you for sharing that with me. Do you consider yourself to be spiritual or religious?
I do.
Do you practice a particular faith or religion?
Yes, I go to a Christian church.
Okay, sometimes patients will tell us about specific beliefs that are important to them. Can you tell me about any practices or beliefs that are important to you?
I've actually never been asked that question before. But one thing that does come to mind is that I talk with my pastor a lot when making big decisions. His name is Pastor Scott. I've been a part of his church for a few years, and I know that my church family is praying for me right now. But that's really all that I can think of. But if I think of something later, can I let you know?
Yeah, of course. Is there anything else that's important to you or give your life meaning?
First God, and then my family. They're all really important people to me. And I really believe in prayer whenever I'm going through a difficult time or having to make a hard decision. I look to prayer.
Okay, you mentioned your family and your church family as being important to you. Do you consider your community to be a form of support for you?
Yes, they definitely are. I've known them for a few years and we pray for each other.
Okay, after sharing that with me, how can we best incorporate your beliefs and make you feel safe while providing care for you?
Just when talking with myself or with my family, I think that just listening to us and answering all of our questions is really important. Sometimes I feel like when I talk with doctors, they're talking more at me and not with me. And also if I'm praying or if I'm talking to my pastor, if I could get a little bit of privacy. But if something urgent is going on, you can let me know and interrupt. That's fine.
Yeah, of course.
I really appreciate you asking me all these questions about my faith.
You're welcome. Thank you for sharing with me.
And so that's a shorter video, and that was intentional. One of the things I think we wanted to convey with this is that even in just a few minutes of interaction, we can get a lot of real rich data, information from our patient about what's important to them. What are those cultural, spiritual values that we can integrate into the care that we're providing to them. And when you look at the faculty guide for that video, again, it's very similar information, but we do provide a reference to the FICA mnemonic. So if you are, maybe doing this in partnership with one of our modules in LNEC, or you're doing this as part of your spiritual assessment, we have that FICA tool there. And then as part of our debriefing guide, we have that FICA tool, but then specifically signal to questions that the nurse asks the patient that would align with the elements of that. So that if you're a faculty member who maybe isn't as familiar with a spiritual assessment, we kind of give some of those answers, so to speak, as part of this. looking at time, I think we have time. For the last video, why not round it out real quick and then we can open up for any last discussion. This last one's a little bit longer, but again, wanted to have an opportunity to see a decision making where there's more than one individual present. A lot of the videos that currently exist within our LNEC database show the patient and a care provider having those conversations, sharing information and having them think through decision making, or perhaps it's the patient and a partner present. But we wanted to show how that might play out in a different dynamic when you have more family members present. So this last one again is family focused palliative care and difficult decision making.
Hello, my name is Darlene and I'm the nurse who works with Dr. Patel. What is your name?
Diane Jimenez.
Ms. Jimenez, before we begin, can you introduce who's with you today?
Yes, this is my son Osvaldo and my daughter Angelica.
Hello.
Hi there. I go by Oz.
Nice to meet you both. Ms. Jimenez, is it okay if Angelica and Oz join in this conversation?
Oh, yes, of course. They are my family and I want them to be.
Thank you. I understand the doctor was just with you and I wondered if you had any questions.
Well, my memory isn't very good.
Since my mom has dementia, it's hard for her to remember things like this. I take care of my mom, which is why I'm with her here today.
So you care for your mother? Ms. Jimenez, since you shared with us that your memory isn't very good, if it were to get to a point where you're unable to make your decisions, who would you want to make those for you?
My son.
Okay, so just to clarify, your daughter Angelica is your primary caregiver, and you want your son Oz to make decisions if you are unable to. Is that correct?
Yes.
It's helpful if we have that information in writing. Do you perhaps have this information written down anywhere?
No, we don't have anything like that.
That's okay, we can work on it. In the meantime, can you share your recollection of what the doctor shared today?
The doctor told us that her kidneys are not working anymore and that she needs dialysis.
What is your understanding of what dialysis is and how it works?
I have a few friends whose parents are also on dialysis. It's supposed to work like a kidney. They tell me that they must go to the clinic all the time and that it takes all day. So many of them say they feel so bad before and are so tired afterwards. Is that how it usually goes?
Yes, dialysis requires a lot of time for travel and the treatment. For most patients, dialysis sessions are 3 days each week and can last up to 4 hours each session. Feeling tired is a common experience, but it's hard to tell just how each person will feel. Does that help clarify?
Yes, thank you. It does sound like a lot, but not as much as I thought.
What are your thoughts about dialysis, Ms. Jimenez?
Well, I don't know. Mijo, what do you think?
It's just a lot of information. Angelica here, she's usually with you most of the time, and I need to work, so I can't be there. I know I need to make a decision, but I just don't know what to do.
I know it's a hard decision, but if this is what the doctor says we should do, then we need to do it for mom. I'll make sure that she gets to her treatment.
I hear you both say this is a difficult decision. It is a lot of information to consider.
I just don't want to put mom through all that. If you remember what happened with dad, seeing him go through all that, it was rough. I just want what's best for her.
Yeah, that was really hard. Dad suffered so much. I don't know what to do.
I'll do whatever Mijo thinks is best.
But mom, I want to know what you want.
I just don't want to suffer. I don't want to be in pain. I don't want to be a burden to my family. They're in my heart and I want to make them happy. And I want them to be happy. What do y'all think I should do?
We never talked about this before.
It can be very overwhelming to make a decision like this. We do have people on our team who help patients and their families discuss what's important to them and to assist with making healthcare decisions. They can also help with putting your preferences in writing. Would it be okay if I asked someone from that team to visit with you today?
Yes, that would be a good idea. Oz, what do you think?
Yeah, I like that. So that would be good.
Okay, great. I'll get someone from the team to visit with you today.
Thank you.
Thank you.
So again, thankful in these videos. We have a mix of students from our traditional and accelerated baccalaureate programs. We have a PhD student, a DNP student. So just we had a lot of individuals from throughout our school join us on this project. And so I'm very thankful for their time. Because also this was filmed the week before finals. So definitely took some time, a time commitment for them. And we're very, very grateful for them contributing. So with that, I'm going to stop sharing. And again, in the last 10 minutes or so, just want to open this up for thoughts that you might have about use in your classes. You know, one thing we encourage you to think about is how might you turn this sort of idea into a teaching strategy? Having students create their own videos. We know a lot of students are very technologically savvy. And so could this be an opportunity for them to create short videos that reflect different palliative care interactions or with perhaps different populations or individuals? So want to open up the floor for that. And then I do have just a few more slides. So we'll discuss and then I'll round out with a few more resources. Hey, Dan.
Hey, so I live and teach in Hawaii, and I don't get a chance to use my Spanish very often. I use it all the time in San Diego, and I was born in Mexico to American parents, and learned to be fairly fluent in Spanish. And when I was 5, I forgot it all, but then I took it in high school and college and relearned it, and so I have an ear for it. And so we're as I mentioned in the chat, we're using a Mexican immigrant patient scenario that was developed by ICOPE, which is I'm not sure what the I stands for, but it's something like Committee on Palliative Education. And it was used by my colleagues at the University of Michigan. They shared it with me. So here in Hawaii, we have people from a lot of different cultures, including Native Hawaiian and Marshall Islands, Guam. So a lot of Pacific Islanders. So I like the idea. Maybe when I'm doing a class in our palliative care sequence that includes cultural dimensions of care from the 8 domains of palliative care. And I like the idea of giving the students an assignment to create a patient care scenario video from a culture that they identify and are familiar with. I think it's a great idea.
Thanks. Any other thoughts?
It's a quiet group today.
Monday. Well,
I guess the question would be, do you think these could be useful? Just broadly, do you think you could use these in augmenting your teaching?
And you know, our hope is that this is the beginning of a process of creating more and more. And you know, one of the thoughts would be that if you do have students that create videos, share them, right? We have the LNAC Faculty Corner where we love for people to share videos like this. And again, it's just going to the website. Anyone can use them, even if they're not using the LNAC curricula, they can still access these videos for use in different ways in their classroom. But I would imagine there are students out there who create really incredible videos, or you yourself as a faculty might create a really great video. And, you know, what would it look like to share that so other schools could use it? You know, for us, again, having that faculty guide was important because we wanted to make sure we set some parameters, especially objectives, you know, for the pain assessment that's not done well, making sure people know we know it's not done well and that's intentional. So, you know, I think having some of that as resource as well is hopeful. But again, that's not the only way that these can be used. And speaking back to the pain videos, Natalie, who was our undergrad student who helped to create the vignettes for her leadership and management course, her group had to do sort of a summative presentation, and They talked about the dangers of shortcuts in healthcare settings, and they used those two pain assessment videos as an exemplar of what can happen when you maybe take a shortcut when talking with patients. And so never did I think that that would be how those videos would be used. But it was exciting to see that it was taken in that way. And it was great because some of the students who were in the videos heard that those videos were being shown that day. And so they came in and watched. So they got to see the work. Let me real quick just share those last few slides because I want to make sure we respect y'all's time and get out on a timely manner. Wanted to just let y'all know that there's a few other resources that we're aware of that are other digital media resources you might want to use. The Hospice and Palliative Nurses Foundation just very recently released, I mean, like this month, released a series of videos that show end-of-life care considerations for different populations, so Buddhist, Jewish, Hindu, and Muslim. The videos range from like 10 minutes to I think some were almost 20 minutes, but you might find those to be helpful.
25 minutes, yeah.
25 minutes, yeah. Those might be other videos that could perhaps be useful, especially if you're talking more at the end of life specifically. And then another resource, I use this a lot in my teaching as well. There's a great documentary called Defining Hope. And there were some scholars who, with, I believe it was ANF, American Nurse Foundation funding, converted those into case studies. So broke the video into smaller little videos, like 5 minutes each, maybe a little longer. And then have a study guide for faculty, again, sort of some questions you might ask, some considerations you might have. So those are freely available as well. And so those can be perhaps a great resource for faculty. And then want to just let y'all know about, if you haven't heard, this exciting opportunity we have this summer. I actually see some of our individuals who are going to be joining us on the call. So looking forward to seeing y'all again in the summer. But we are hosting a workshop for faculty. It's focused on undergraduate education, but really structured as the how can you integrate and teach palliative care within undergraduate programs. So not necessarily what is palliative care, but how can you respond to the essentials with naming palliative care as a sphere of care and integrate this into undergrad programs. We're still accepting applications. The only expense is travel and a few meals, but registration and housing and materials and some meals are provided through grant funding. So please, if you're interested in joining us, again, the applications are open till April 1. It does require a letter of support from someone in your school saying that you're an individual who will be supporting integration of palliative care in your undergraduate programs. And then we do have a limit of 2 faculty max per academic institution, but we still have spots. We would love to have more individuals join us. So please consider checking that out and applying if that's of interest.
I just put the direct link in the chat for you.
All right. Well, thank y'all for joining us again. We really appreciate it. This was sort of launching a new series of webinars for us over the next couple months. We want to show some resources, but we'll also in the coming months be hearing from some students and sharing some of their experiences and some unique learning opportunities that they had in their programs. And if you have something you'd like to share, if you have student experiences that you'd like to bring forward, we would welcome that. And also for the fall, our series, tentatively, our plan is to try to highlight some elements of graduate education and palliative care. So if you have thoughts or know of individuals doing great work in graduate education, please send them our way. We would love to be able to highlight the great work being done throughout the country in supporting graduate level education in palliative care as well. So with that concludes our meeting. Thanks
you all for
everyone
being
for
here.
attending.
Bye, everyone. Have a good week.
Bye.